My dear student, this is your clinical class. This is your clinical class. My question is, what are the aim of this class? What are the aim of this class? The aim of the class is history taking, patient examination, then history presentation. Means salient feature or case summary. Remember this. First of all, how to take a history? It's a drama. It's a drama how to take a good history. History should be taken from patient himself or from attendance. Remember this one. The history should be taken from patient himself or from attendance. This is one of the art. How to take a good history. First of all, you have to introduce. First of all, you have to introduce with your patient. You greetings to the patient. Okay. If the patient is Hindu, then give a namaste. If the patient is Muslim, then you will tell Assalamu alaikum. If the patient is Christian, then you should tell good morning or good evening like this. Remember this one. After this, then you should introduce with your patient. Remember this one. You should give the greetings to your patients like Assalamu alaikum. Then handshake. Handshake with me. Handshake with the patient like this. Then handshake with the patient. That is, the patient will be relaxed to you. Then you ask, why you coming here? That is chief complaint. Why you come here? What is the problem of you? This is the chief complaint. After chief complaint, then after chief complaint, then you will elaborate. Then elaborate the chief complaint. After elaboration of the chief complaint, then you ask some cross question to the patient. This is called systemic inquiry. This is called systemic inquiry for differential diagnosis. Remember this. For differential diagnosis, then you ask few cross question to the patient. Remember this one. After history of present illness, then go for history of past illness. That is, the patient suffering from any disease before that time, anytime. This is the history of past illness. Then and then in a pediatrics ward, in your pediatrics ward, then and then go for birth history. Remember this. Birth history, that is antenatal, natal, postnatal period. After birth history, then go the feeding history. Feeding history is very much important. Or pre-lactal feeding given or not, colostrum given or not, exclusive breastfeeding up to 6 months given or not. You are asking them about the feeding history. After this, then you will go for development history. The development history means it start from social smile. Usually social smile appear at the age of 4 weeks. Then after social smile, then you look for leg control. You ask him neck control. Then when the neck control is coming? Generally, neck control is come at the age of 3 months. After neck control, then asking when the baby is sitting. When the baby learn to sit. Usually, baby is sitting at the age of 6 months. After sitting, then you asking when crawling. When crawling is started, it is usually 8 to 9 months. Remember this. After crawling, then asking when standing the baby. When stand the baby, it is usually 12 months. 12 months of age, baby can stand. After standing, then you asking him about the walking. When the baby start walking, it is usually at the 15 month. Remember this. At the 15 month age, baby can walk 1, 2, 3, 4, 5 steps like this. Okay. After this, then ask you about the space. Space, 1 word or 2 words, and 2 words, making a sentence with a 2 words at the age of 2 years. Remember this. This is your development history. After development history, then you go for immunization history. After immunization history, then family history, then socio-economic history, then treatment history. After treatment history, then you go for general examination. General examination, everybody should remember there is 24 points. All 24 points you should be remember this. After general examination, then go for systemic examination. Systemic examination, you should examine the patient is which system. If the patient is cardiovascular system, then first time you start with examination of the cardiovascular system. If the patient is the patient of alimentary system, then first examine alimentary system. Then other systems should be examined. After all systemic examination, then you go for case summary or saline picture. Case summary or saline picture. After saline picture, then you given provisional diagnosis. Provisional diagnosis, your provisional diagnosis. After provisional diagnosis, you must sure your provisional diagnosis is correct. Your 100%, your 100% you say this is your provisional diagnosis. For this, what will do? Then you given some points in favor for your provisional diagnosis, and some points in against for your differential diagnosis. Remember this one. After this provisional diagnosis, then you go for investigation. After investigation, then go for confirmatory diagnosis. After confirmatory diagnosis, then give the treatment. Then give the treatment plan. Treatment is according to cause. Treatment is according to cause. After treatment, then give the follow-up of the patient. How the patient follow up? They given the follow-up of the patient. Remember this one. After the follow-up, then they given the after follow-up, then the counseling, parents counseling about the natural history of the disease and its outcome. Remember this, the natural history of the disease and its outcome in home and abroad. Remember this. Up to this,